All right, so Bartholin cysts. So some of you might have heard about a Bartholin cyst or had a Bartholin cyst or an abscess, which is always very possible, but I'd like to talk a little bit about it and where they're located. So Bartholin cysts are actual little glands that normally exist down here by the vaginal opening, and they actually release secretions into the vaginal opening for lubrication and such. So sometimes these little glands can get blocked by, it could be anything, an infection, something, but sometimes they can get blocked. And if they get blocked, they enlarge. And if they enlarge, they can sometimes become painful. Sometimes they're not. Some patients have them and nobody even knows that they have them, and they're noted on exam, or they just feel it down there like a lump. But sometimes they enlarge like a cyst. If they become infected and that fluid cannot escape and cannot get out, it can become an abscess. An abscess is much more painful. Usually, sometimes it's real tender. It can be very large, very tense, just very, very tender, very uncomfortable, hard to sit down. This is when some patients will come in to the office. Sometimes they're just coming in because they're very large and they're not sure what it is and they're worried about it. Or it could be an infection where they're very, very painful. If it's very painful and an abscess, sometimes we actually have to numb it a little bit and open it and drain it. So an incision and drainage to drain the fluid out of there so that it's treated, basically. We'll give an antibiotic to help with the infection, but usually that's all it needs. Sometimes we place what's called a word catheter, which helps to keep that little opening open to keep it draining so that it doesn't fill back up and back up. Sometimes we can do what's called a marsupialization, which is where we stitch it open so that it continues to drain and doesn't block back up. So sometimes they can be excised if you have recurrent ones over and over. Sometimes we can excise those, but those can be treated in the office typically. But yeah, that's what a Bartholin's gland cyst is, and it's located at the very bottom part, down at the end, right there. They're not at the top, not in the middle. They're more down in the lower area on the bottom corners. So let me know if you have any other questions about it.